Welcome to Conversations with Melissa, part of RenaFi's Experts and Influencer series. RenaFi provides practical, research-based advice, courses, and peer support, and focuses on the underlying drivers of our ADHD behavior. Through courses like budgeting for the ADHDer, home organizing for the ADHD lifestyle, and of course, our ADHD book club, to name just a few, we provide a holistic program that serves to help you thrive with ADHD, not in spite of it. Follow our YouTube channel for ADHD resources and information, and visit us at renafi.com to learn what we have to offer. Thank you so much to our guests here, Dr. Bill Dodson and Beth Bardeen. So today we're going to do RSD from two perspectives. We have Dr. William Dodson, the clinician, what RSD looks like from the outside in. Dr. Dodson is a board-certified adult psychiatrist who does not have ADHD. He has worked with his adult ADHD patients for the last 25 years to understand and document rejection sensitivity dysphoria. Dr. Dodson has been on the forefront of diagnostic and treatment reform for ADHD and rejection sensitivity dysphoria. He is now retired from clinical practice and resides in Colorado. Beth Bardeen, the RSD survivor, what RSD feels like from the inside out. Beth is an adult diagnosed with ADHD after a 30-year career in the Seattle tech industry, specializing in marketing and organizational behavior. Now Beth researches rejection sensitivity dysphoria and is an advocate for the newly diagnosed, with a focus on explaining the internal experience of RSD. She lives in Seattle and is the founder of the Seattle chapter of CHADD. All right, thank you both for being here. And
Melissa, thank you.
I'm just going to step out of the way. I'm going to take the focus off me and let you have at it and interrupt you every so often.
Sure. And thank you, Rick and RenaFi too. This is, we love this opportunity, really appreciate it.
The decisions that are made at Centers for Medicare and Medicaid are made on the basis of money, period, end, stop, money, 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 money. Again, that's not what CHADD and ADA and stuff like that, organizations like that, really see as their mission. ARP, my Association of Retired Persons, they have some sway with Centers for Medicare and Medicaid, but our ADHD organizations don't have any.
Well, there's
great tip for a partnership. Thank you.
Yes, great tip for a partner. Yes, indeed. Let's look at it as the opportunity.
Get it.
It is. There's definitely room for more advocacy. Okay. I was looking to see what I had for questions here. You know what? I'm gonna step out. There are still some questions in here. I think when we were talking about the methylphenidate, if I'm even saying it right, says that there's a side effect. Oh, it's the Ritalin has a side effect of anxiety, but I already have anxiety. And I say, make more close friendship with your prescriber.
When it has been looked at in research studies, double-blind controlled studies, they have not found that stimulant medications used properly make anxiety disorders worse. Now, if you overdose and you get the Starbucks syndrome, yeah, you're going to feel jittery, but will feel as if your anxiety got worse. But again, if you add a stimulant and you start having side effects, you either have the wrong molecule or the dose is too high. It's very simple. There are only two possibilities.
I am gonna pause with the questions and let you guys finish to make sure what else is left in the presentation, and we'll come right back to questions. I still have a little tally of a few of them.
Okay, you're on. Beth.
We're almost done. We're through
We've
the
answered a lot of
most
these already.
exciting part. This part is what I was talking about earlier about figuring out what works for you. There's a ton of things. There's a ton of stuff out there on the internet. It's really hard to wade through. But most importantly, I was faced with my doctor. I thought she was amazing for 20 years until I told her that I was being treated for ADHD and RSD. And she was, I think she looked like, the look on her face was most like the guy on the far left. My ADHD MD said, go back and talk to her just in case you misunderstood. I did. I didn't. She printed out the notes for my visit summary and absolutely would not work with me anymore because she did not believe that adult ADHD, let alone RSD, was a thing. And I thought that was my experience. But I've talked to a lot of people that have gone to their GPs or their family doctors, and they just don't know about it. They only have 15 minutes to spend with you anyway. And the best outcome if you go to your GP is to ask them for a referral to somebody that is an ADHD specialist. And going back to what somebody said earlier, you'll know you're with the right doctor when you bring up this stuff and they're respectful and curious and want to help you, even if they've never heard of something before. If they're respectful and curious, they will go learn about it, just like they would with any other condition that you presented with. Yeah, but how to find one. I mean, this is especially since the COVID pandemic, we are really at a shortage for providers in general, mental health providers, and specifically ADHD providers. And so when we give you a disclaimer at the front of this presentation that says, please work with your ADHD specialist team, that's assuming if you can find one. So start with your local CHAD chapter, shameless promotion. And because I'm amazed at when we start talking about having these conversations, somebody will say, oh, my doctor was completely open to an alpha agonist. And then everybody wants to know, what's your doctor's name? And so there's a lot of this sharing of who is out there in your area, who's taking new clients and open to safe treatment protocols to help you find the right meds and the right dosages. There's a ton of ADHD Facebook groups. The one here in Seattle, I think it's like ADHD adults in Seattle. And there's a lot of good information on there. There's a lot of meetup groups as well. So I don't know if it's like that in every metropolitan area. Check the providers out. I know Chad Attitude Magazine has a really great directory that you can really slice and dice what you're looking for. And then Psychology
And
Today
it's all
has
free.
They're all free. They are, and they work, which is great. Check with your insurance company's provider list. Sometimes that's tough to do. But they will know who they will cover. Ask your family doctor. One thing that when I used to work in tech, every tech company I worked for had these affinity groups, and they all have an ADHD affinity group. So if you work for a large enough company, check with your HR department. It's not so hidden anymore. It used to be that a lot of these affinity groups, you had to know somebody to find out that they existed. Next slide, please. There we go. Okay. So I kind of just talked about this, the difference between a general practitioner and an ADHD specialist is really in the amount of training that they've had about it. So one is familiar, the other one isn't. If you go to a general practitioner and talk about what you're experiencing, the words that lay people use mean something different to clinicians. So if you say, I feel anxious, my mind's racing all the time, they will see and hear anxiety. If you talk about strong emotions, they will see bipolar or borderline. If you go to an ADHD specialist, they already at least know what's in the DSM. As limited as that is, it's a great starting point to make sure that at least you'll get on the right path and not spend that cycle of repetitive 6 to 8 weeks trying different antidepressants and anti-anxiety meds and finding that they don't really work.